Hi friends, I'm Dr. Sudip Chowdhury again. I'm the Paediatric Consultant at Bmi Medical Clinics. Today we're going to touch upon a very important subject rather. It's about obesity in kids. So I understand that majority of you share my opinion that obesity is becoming an issue day by day in India today. And we've seen more of these in pediatric practice in recent years. Now, this was more of a problem in the West initially, but then till recently, owing to increasing wealth in India, we are seeing that more and more obesity and lifestyle diseases. Now, the question is, what do we do about it? So today we'll just touch base upon obesity, how it is defined or diagnosed, and then what you as parents can do to make things easier for your kids so that they don't turn up being obese, or if they're obese, then how you can actually change their lifestyle or modify their lives so that they can be more slim and trim and become better citizens tomorrow. Now, how can you classify a child as obese or overweight? Now, for this you have to understand one basic parameter called BMI, which is the body mass index. Now, how is BMI calculated? A simple formula, it's weight in kgs divided by height in meters, the whole square. Now, why is BMI important? Because we have seen that in case of overweight children, the BMI is generally above 85th percentile for the specific BMI chart for children, whereas for obesity, it has to be above the 95th percentile. It will shock you to understand that so many kids today in the schools are obese or overweight. By a rough estimate, around 20-25% of kids in Delhi NCR were found to be overweight in their respective schools in 2019. Now, why do kids become overweight or obese? A number of things do contribute to a child becoming overweight or obese. Now, it could be multifactorial, I will say, but then diet habits along with the lack of regular exercise, some amount of genetics, or a combination of these can be involved in getting a child obese or overweight. You should also understand that it could be genetic at times, some metabolic conditions, or also it could be due to some medicines, but those are rare conditions. Now, the question next comes is how do you prevent obesity? Lifestyle changes has been more difficult with this lockdown, I understand, especially because children are staying at home with parents, a lot of binge eating is happening, lack of exercises, and all of these together are actually adding up to their worries. But then what do you do now? What you can do is you can try and create an active environment. How to do that? You should participate in regular physical activities, at least 60 minutes, we say, as per the recommendations by American Paediatric Association of moderate to vigorous physical activity. You can enroll your child in a structured athletic or a recreational program if that's possible. A lot of them are options are available online these days. Most importantly, I want to underline is you should limit watching TV or iPhones or pads for at least less than an hour a day. I know that's difficult. I completely understand that. It's mainly because your kids are at home. They are very disturbed already. You don't want to make your lives more difficult, but try and do that because that may help you a bit. Something to underline here is to create a healthy eating environment at home. I always tell parents to have a family time together in the dinner table because what you eat, your child sees that and the child eats that. So if you eat healthy, your child automatically starts eating healthy. I know it's difficult to resist a burger or a pizza occasionally, but then that should be really occasional and not a routine every day. Avoid rushing into meals. That's very important. Also, avoid rushing finishing off meals because the more time you chew the food, the better your food is absorbed and the lesser chance is it that your child turns obese. So don't binge on your food. So then avoid foods that are high on carbs or fine carbs. Try and take more of fibrous food in your carbohydrate intake. Have a lot of vegetables because they are filling at the same time. There are not much of carbs in that. Limit the frequency of fast foods to at least like once a month and carbohydrate drinks to less than a week, once a week. Keep cheat days because I think children love to binge at times on these things. But then if you keep them with a cheat day, like give them a reward for like 6 days of abstinence on these things, I think that goes a long way. Now the other point is how do you treat obesity? So once obesity is established, so that's the more difficult part. So what we do as pediatric endocrinologists is we go through a diet chart. We refer you to a dietitian who helps you with making or recommending your diet chart. And then it's up to you and the child to follow it. That's your responsibility. We'll be there with you. We'll be answering all your questions, you're answering all your doubts about obesity and you're being overweight, but then the onus lies on the child and on you to follow those guidelines, follow the dietitian's advice. A bit of behavioral therapy may be helpful in children at times, because I think children do understand by their means. When you tell them that healthy eating is actually the in thing, is actually the thing which their superheroes do, I think they do imitate the superheroes and actually they follow those guidelines. So I think a bit of behavioral modification does help. But last but not the least is exercise. Please, please, please try and tell kids that they need to go active. I know it's difficult when you are at home, when your kids are at home. Try and take them to the terrace, try and take them to the nearest park when there are not a lot of people around. Tell them to just give a quick run around, at least 30-60 minutes of exercise, some steps. I think all these things contribute a lot. I hope this has helped, but anyway, if you have any questions about this, just visit our website at www.drvmedicalclinics.com or go to my personal website, drsudipchowdhury.com, and you'll find answers to them. Thank you.